Hello and welcome back to Everything is Super Peachy, right? Please consider liking, subscribing, and following the channel. If you're feeling what I'm saying is striking a chord with you. So I have a couple of clips, basically just talking about the closing of hospitals. There seems, as always, to be this chorus of bad companies, bad corporations, evil companies, evil money, so on and so forth. And let's just take a look and see what they're talking about.
Pandemic.
The pediatric unit shut down suddenly.
Tufts Hospital for Kids in Boston shuts down.
Since 2008, 20% of pediatric departments in hospitals across America have closed.
It's pediatric intensive care units.
Kids tend to need less complex care than adults, and that means they make less money for hospitals.
Transition into additional.
Now you see how they're painting, oh, well, they make less money, and this is the problem because the companies, which hospitals are, they're for profit. They're not paid by tax dollars. They're paid by people paying for services rendered.
Bids for its adult medical
Decades of profit-driven decision-making have gutted pediatric healthcare.
Closures could be life-threatening for sick kids.
We are losing such a vital service.
But there's another reason kids aren't lucrative. The government pays for the majority of children's healthcare in the US, mostly through Medicaid, and they woefully underpay. In America, saving kids.
Well, why is Medicaid underpaying for services rendered? Life-saving, life-changing, life-altering. Why would government-funded assistance not pay full, quote-unquote, market value for services that save lives of children and the rest?
Is just bad business. That's a balance they shouldn't have to strike. This surge has exposed a failure of our healthcare system. The US is ill-equipped to care for children in emergencies.
Why is the healthcare system ill-equipped to handle the plethora of children that at any given moment need medical care?
Respiratory viruses don't just occur near pediatric ICUs, nor do more common accidents like car crashes. Children deserve access to care in their own communities.
So again, the battle cry of deserve, 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 regardless of anything. Children deserve, mothers deserve, fathers deserve, families deserve. Constant battle cry.
The government can fix this by incentivizing hospitals to invest in pediatrics.
Well, how can a government incentivize hospitals to invest when they just stated that the hospitals are being underpaid because there tends to be an abundance of children on Medicaid, which they noted that does not pay full value for full services rendered? Again, they make it seem like it's just profit-driven greed as to the reasoning that hospitals are closing all over the country. Let's continue.
900 deaths reported in 2020, and 2/3 of those deaths were determined to be preventable. That's according to a new report from the March of Dimes, a nonprofit organization focused on maternal and infant care. The report found that as outcomes get worse, so too is access to high-quality maternity care. Ali Rogan has more.
This new report found GYN doctors, hospitals providing obstetric care, birth centers, or certified nurse midwives. Those counties are also home to 2.2 million women of childbearing age and almost 150,000 babies.
So just like they talked about food deserts, they're also talking about maternity care, neonatal care, deserts. But again, why are there deserts existing all over the United States? Is it because of the greed of the hospital, the shortcomings of the government, or is it because the abundance of individuals, be it mothers or the parents of the children that have their children on Medicaid, which has been stated does not pay full value that the hospitals need in order to be functional and be able to provide the services consistently.
These figures have worsened over the past 2 years, with the number of maternity care deserts increasing by 2%. Two along racial lines. In 2020, more than a quarter of Native American babies and 1 in 6 Black babies were born in areas with limited or no maternity care. To help us understand why this problem is getting worse, I'm joined by Pei-Yin Hung.
Now, again, it's always Blacks, minorities, people of color that are suffering disproportionately in comparison to their counterparts, non-Black and brown people.
She's an assistant professor at the University of South Carolina Arnold School of Public Health and an expert in rural health and disparities in care. Pei-Yin, thank you so much for joining us. Now, if I'm an
See, now you see that regardless of these data points to be researched and studied, there is somebody studying it. Let's take a look at what this individual has concluded.
care desert, what does that mean for my care? Why is it that the racial disparities in maternity care continue to be so stark?
Yeah, in our research, we found that rural hospitals, they are much more likely to close their obstetric units when they are located in communities that have higher proportion of African American reproductive age women, and this is kind of associated with the heavy reliance of Medicaid insurance. We know Medicaid paid about half of, on average, private insurance.
Now, she said that most of the closures, now she said rural, but there's really code for economically depressed, because it's not just rural, it would also be urban areas, and we know what that means. Rural, you tend to think of white people, but she's saying rural, but she might as well put a slash and say urban. And she's noted that, because might be hard for some people to understand what she's saying, but she says that there is a high propensity of hospital closures in areas where there is a high percentage of African American females of birthing age, basically, who are relying on government assistance. And the government assistance, she stated, it pays about 50% of what the actual bill would be if somebody had full coverage through their job, or that Cobra, which is, I've seen that once and I was like, I gotta get another job quick. Anyway, but she's stating that there is a high propensity of hospitals going under in areas where there's a high proportion of African American females of birthing age who are on public assistance.
And on top of this, there are different kinds of malpractice premiums and all those that add to the financial distress facing rural and small hospitals to really maintain this costly and unprofitable obstetric services.
Now, the fact that the hospitals are closing is because the services that are being provided are very costly, and the hospitals, as they are for profit, aren't able to sustain themselves. So people, so these news coverage want to make it seem like, oh, bad company, bad CEOs, bad this, bad that, when it truly is the reliance on government assistance to such a large degree that is causing these hospitals to basically close, go under, however you want to put it. Let's continue.
CBS News investigation that finds healthcare institutions that Americans rely on are being taken apart and then shut down by investors who are looking for profits.
Again, they want to make it always seem it's about profit, profit, profit. It's just about functionality. There is nothing that can function properly and effectively when the output is severely higher than the input. No business can survive. No household can survive. If you got $120,000 in credit card debt, but you only make $65,000 a year, you're in bad shape. So, as we know, corporations are entities that are basically in line with an individual, according to for tax and political services purposes. So if the hospital is not able to maintain a balance of actually a profit above a balance of functionality, paying taxes, paying insurances, paying their employees, paying for groundskeeping, paying for security, paying for medical equipment, and everything else that hospitals need in order to function and provide the services, how do you say, oh, well, let's throw something else on top of it and say, give it for free? How does that work?
Investigation focuses on one company in particular that made millions of dollars and then closed some of its community hospitals.
Millions of dollars, yes. But why? If the hospitals were able to function in the black as opposed to in the red, would private investors come in and swoop up and buy these hospitals and part them out and make money? Because that's all they're doing. I mean, everybody knows that a brand new car off the lot is worth more chopped up and parted out than actually if you just drive it for, the next year, 2, 3, 4 years. If you part the car up, it's worth more in parts than it is as the whole. And that's what they do. Making it seem like it's evil, but it's the economics of business, of functioning. Nobody can chop it up into individual pieces if it is survivable and actually in the black.
Patients scrambling for care. It's part of a larger trend of investors from the world of private equity snapping up everything from local doctors' practices to specialty clinics and even hospice care centers. Our chief medical correspondent, Dr. John LaPook, is here with the story. John, this is a big one. Good morning.
Yeah. Good morning, Tony. For nearly a century, Delaware County Memorial Hospital in suburban Philadelphia delivered babies, treated trauma, and tended to the critically ill. That all changed earlier this year when its current owner, a Los Angeles-based company called Prospect Medical Holdings, began cutting services. First, the maternity ward went, then the operating rooms and the ICU, and then last month, the emergency room closed its doors to the community's nearly 85,000 residents.
Of those 85,000 residents, how many of them were on public assistance? How many children in those areas were on Medicaid? No business, and again, hospitals are businesses. How does a hospital function and continue to provide needed, necessary services to the community if the surrounding community is predominantly or well above 50% on public assistance, knowing full well that they do not pay full? The reason why that The reason why Medicaid and like don't pay full is because they don't want you on that forever. It's actually a sharp stick that they're putting in your back to say, okay, you can only go to this hospital, whereas opposed you can go if you had insurance through your employer, you can say, oh, well, you know, my child is suffering from X, Y, and Z. This hospital can't deal with it, but I can take my insurance and go to the Mayo Clinic or any of the other quote unquote top-notch hospitals across the nation. But that requires you to have, you know, that top tier, gold, platinum, diamond status insurance. If everybody had top tier insurance, these hospitals would not be closing. So it's not on the government's it's not for the government in itself to make sure that everybody gets the quality of service that is necessary. Yes, it's necessary, but it's not the government is not going to do that. They cannot support that. Income has to supersede outcome. No. The income, the money that the government takes in has to supersede, you know, these public assistance programs has to supersede the output. That's the only way it works. If you listen to people who have talked about, oh well, yeah, well, I can't use my medical insurance here, I can only use it here, or my primary care provider is in this area, my insurance covers it, that's fine. But then they'll say, oh, well, your treatment is at a hospital that's not covered, so you end up paying out of pocket. Yeah, it's janky, but you have to not understand. We have to be very aware of what you get for quote unquote free is not going to be the best. If you have, shout out to Pete, if you have 5 cars and you give a car away free, are you going to give your best car away? Or are you going to give the car away that is functional? It's not the best. It burns oil. The tires are bald, you know, pulls to the right. The AC doesn't work as good as it could in the summer, or the heat is trash. You're not going, whatever you get for free is not going to be the best of anything. Let's continue.
Couldn't see a hospital closing down if this was a more affluent area.
Delaware County official Monica Taylor.
But why wouldn't it close in a more affluent area? Why would hospitals not close down in a more affluent neighborhood, city, town, whatever it is? Why wouldn't it close? If you're more affluent, that's a less amount of people who are, not saying it's zero, but there's less, considerably less amount of people who are on public assistance, Medicaid. So there's really no reason for the hospital to close. Not saying that it can't happen, but the probability is severely less. Not zero, but it's less than when you have a high population of people who are on public assistance, because public assistance does not pay like private health care.
Says closing what's considered a safety net hospital will hit the area's low-income population hardest.
What happens to a community when it loses its only emergency room?
They say what happens? It gets worse. It gets worse for the residents. You quote unquote get taxed. You have to travel further. Do you have the means to travel further? You're paying a tax. Can you afford to travel further? You're paying a tax. It hurts the community, but the what's it called? The cornerstone of what is hurting the community is that there are abundance of people on public assistance. But they're saying, oh well, the government needs to incentivize hospitals to do more. How can they do more if they're not if it costs $1,000 for a service and the government is saying through Medicaid you getting $382, you short 600. Wait a minute, 500 and change. No, I was right, 600 and change. How do you do more with less and actually provide more? Look at this. States are repealing laws that what is this? States are repealing laws that cap financial aid to low-income families. It's supposed to dissuade welfare recipients from having more children, and they said that it hasn't worked. Why are they trying to dissuade welfare recipients from having more children? Is it my body, my choice? Is that it? They're trying to control the reproductive rights of individuals who are financially in bad situations? Is that it? Or are they trying to say, hey, this is not going to work? We need more of y'all to get off public assistance. Then maybe the hospitals around you, the grocery stores around you, any of the other services that are highly desirable around you can exist, continue to exist, or even get better. Critics of the cap point to research showing they failed to dissuade welfare recipients from having additional children. Instead, researchers say they can harm children's health and development and deepen poverty. Again, they're trying to keep things functional. They're trying to keep things better. The government, the city officials, the state officials do not benefit from the spreading of the lessening of quality of services that can be provided. Okay, a nonpartisan team of researchers, pediatric, blah, blah, blah. Preschoolers were subject to Massachusetts Family Care reported more household and child food insecurity and poorer health among children. Okay, and the reproductive rights, similar conclusion, found that family care didn't decrease the number of children born on public assistance and push families further into poverty. Poverty isn't just financial. Poverty is availability of services that are abundantly needed for everybody. Poor, unhealthy, wealthy, unhealthy. Unhealthy is unhealthy. The necessity to having more and more healthy people in an economy is desirable. Yes, there are institutions that make money off of people being sick and believing that, oh, well, I have this ailment because all the commercials on TV. I need to get on this. Oh, well, this drug was for this, but it's been repurposed for that. Yes, I understand that. But as a whole, a healthy economy requires healthy individuals, requires healthy children. Believing that a government has to go above and beyond its means in order to provide is not sustainable. There are too many other things that have to be dealt with besides providing medical care for the children. Medical deserts for children is bad. Emergency care deserts for communities is bad. It is up to the individuals to at least have a plan to get off of these government assistance programs. But when you have generation upon generation upon generation of people, of Medicaid recipients, we cannot boo-hoo and say the government needs to do more. They're not capable. We can even go so far as saying that they're not good at their job. So relying on them to do something probably is not going to have the best outcome for any and everybody. If they're so desperate that they're trying to dissuade people on welfare assistance from having more children, I think that's their battle cry, saying we can't do this. We started this as a safety net for people, but eventually something's going to give on that safety net, especially when more and more and more individuals are on it. Anyway, please consider liking, subscribing to the channel. It'll be greatly appreciated, and thank you.